I would like to start by thanking our American Sign Language interpreter, Rose Coman, for her assistance tonight. If you need sign language interpretation tonight, there is an opportunity to pin Rose. If you hover up near her name, you should be able to pin video, and this will allow you to see Rose throughout our time together tonight. My name is Deaconess Joanne Rich, and I'm a community planner with the Juvenile Welfare Board of Pinellas County, Florida. I'm also a member of the planning team for tonight's webinar, Reopening Our Community. Your video and microphone are muted right now, but we encourage you to use the Q&A feature at the bottom of your Zoom page or the chat feature to ask questions. We are so happy to have you all present. A special thank you to the Pinellas County Emergency Management for their leadership in these efforts. This is our first webinar in what we hope will be multiple webinars for the faith-based community in English and Spanish. This has been a new adventure for our team, as we know many of you from around the community are also navigating new pathways in your ministry utilizing online tools. Wow, such a difference a few weeks and months. We have navigated the COVID-19 virus coinciding with Passover, Easter, and Ramadan, and other religious days of importance. This week is also Hurricane Preparedness Week and the National Day of Prayer. What better time than for us to come together, even if only virtually, to hear from some of our county leadership and others who have been trying to best assist our faith community in how we can move forward during this time. I want you to know that this webinar is being recorded and will be available later on in the week on the Pinellas County webpage, and we will be providing you a link after the event. We hope as we move through the speakers tonight, we will be able to take some questions following each speaker. And then at the end of the time, if there's still additional time, we will take additional questions. Please no anonymous questions. Please note that if your question is not answered tonight, we will be doing a follow-up correspondence with a Q&A sheet so that everyone can have the answers to the questions that were posed, even if we do not have time to answer them during this session. There will also be a slide shown at the end of tonight's session with the contact information for the various speakers. So who do we have as key speakers tonight? Well, we have Arelis Escalera, who's the Community Outreach Coordinator and Public Information Officer with Pinellas County. We have Linda Wilkins, the Content Strategist for the Georgia Baptist Mission Board. Linda's department has been the communications hub, and she and her colleagues have worked hard to create web resources relating to opening congregations in the context of COVID-19, and they have shared with us to best assist congregations. She'll be sharing with us lessons learned as she has gathered these important resources. We also have Gail Guidish, the Disease Control and Health Protection Division Director for the Florida Department of Health, Pinellas. If you attended the opioid crisis and the faith community event, she was our keynote speaker and always gets rave reviews for her knowledge and compassionate care she brings to the county. She's always willing to assist congregations, synagogues, and mosques, and other houses of worship address the tough health issues of our time. Now, before we hear from our speakers, let's hear from Mary Burrell, who is the Whole Community Engagement Program Lead for the Pinellas County Emergency Management and the chair of our planning team, so she can share a few brief words with you.
Thank you, Joanne. You know, after 9/11, our houses of worship were packed. Even people who didn't usually go to the services, we were just so confused, and we needed answers, and we needed guidance, this scary new world of ours, and we needed faith. And as spiritual leaders, you were there for us. And, you know, through history, our spiritual leaders have really been our first responders during disasters. So now we have COVID-19, and you all responded in the same way. So many things, but for example, we have food pantries throughout this entire county. It's amazing. Some of them are at your facilities, you work at others, and your members work at so many more. It's enabled us in Pinellas County Emergency Management, our other departments in Pinellas County, to do what we need to serve our community. And it's that partnership. That's whole community. FEMA calls it whole community. And what that means is that we're bringing together our resources, the government, faith-based communities, yes, and businesses, nonprofits, bring all the resources together in one community so that we can respond better and everybody get what they need. So during COVID-19 in the Emergency Operations Center, in addition to emergency management and our departments, we have our faith-based leaders, we have community members, and we have a lot of working groups because we have so many needs in the community. Our group is for faith-based communities, and we've been reaching out to you to communicate with you and to also see what resources you have and which ones you care to share. And you do have so many. I mean, you're calling people at home, you have spiritual counseling, and there's other things that we're asking you about. You know, maybe down the line you have some volunteers that like to be trained to work at a shelter. You know, maybe even have a facility that could be a shelter. So it's that partnership that is really so important to us. So what do you need? Well, what we hear from you is that you need information. Opening the government, you know, the country, the state, opening the county. What does that mean to you? I mean, we all know you're not planning on opening your services tomorrow, but you know, you may not even know how to plan. You know, people just need a little help. So we're hoping that we're going to be able to give you a little guidance, some ideas, some places to start with that planning, and then, you know, please let's do this together. And so let's start this conversation. Thank you so much for being here with us.
Great, thank you so much, Mary. Now we'd like to open it up with Aurelis because we've known there's been governor's orders, state orders, county orders, some local principalities orders, and it can be overwhelming to keep up. And so we're just asking if Aurelis can help us. What is the latest and how we can stay best informed with the do's and the don'ts and who to contact should we have additional questions. So Aurelis, please help us navigate this.
Good afternoon, and thank you for having us. Like you said, we have a lot of information to share with all of you, and everything is very accessible. You can go to our website, pinellascounty.org, and you can go to the top. There will be a yellow bar, and that it's at our COVID-19 page. When you go to that page, you can get the most frequently asked questions. You can find where to get help, how to help, testing and health information, business information, and some tips for the people who are staying at home, how to, you know, keep entertained the kids, and more information in that stay-at-home tips. With the frequently asked questions there, you can also find all the orders that have been published by either the governor or the county. And you can also find the details for the phase 1 of the governor's reopening plan and the guidance that the county published with all the details. And this information is available right now only in English, but soon we will have the page in Spanish as well. And we have some materials that are already translated to Spanish and Vietnamese that we share with our communities. So you can find all these documents, all this information in our website. We also have our Facebook and Twitter and Instagram. And we work hand in hand with our ASL translators, and we put together short videos, PSAs, with the information that is most needed and is already translated with an interpreter of American Sign Language. So it's available for all of our communities. And those short videos are available in our Facebook, in our Twitter, in our Instagram, and our YouTube page as well, which is BCCTV1. You can find us there. And you can access as well via our website and our COVID-19 page.
Thank you, Aurelis. I really appreciate all that you're doing, and I know there's, if people are wanting to tune in or give public comment to the various council meetings for the county, can you explain how they can do that?
Yes, indeed. Every meeting, it's being it's aired via YouTube, our county page, and it's a Zoom meeting actually that is happening. So our citizens can participate in those meetings. The moderator will ask if there are citizens that wish to be heard during a discussion, and they will get the instructions there how to unmute their phone and participate in the meeting. They will have 3 minutes to express their concerns regarding the specific topic that is being discussed at the time. And I must say that we also have 2 other different broadcasts. Commissioner Pat Girar, our commission chair, I should say, she also does Facebook Lives, and the Sheriff Bob Gualtieri and the County Administrator Barry Burton, they also have Facebook Lives weekly to answer the questions about all the changes that are going into place that week.
Okay, thank you. If anybody has specific questions for Aurelis, they can put those in the Q&A section, and we will address those later on and come back to her. But I want to take us now over to Linda, and sorry, I'm just lost my sheet here. Wanted to say her name right. Linda Wilkins, who we have she's so graciously accepted to join us from the wonderful state of Georgia. And you may have known from the news, you know, that Georgia's gotten a lot of coverage because they were encouraged to open a little sooner. And so while our churches haven't been prohibited from opening, we've certainly been encouraged to not open for as long as possible. And so we just wanted Linda to share some of the work she's been doing, and she's going to also be sharing some of her web links with congregations because they have compiled some extensive resources. So Linda, thanks so much for joining us, and please share with the group all of your wisdom that you've garnered through this journey.
I'm glad to be here. Thank you so much for having me on. Obviously, you know, this was not something that we were prepared for in any way, shape, or form. It really took us by surprise. So initially, you know, my position with the research and development team is to gather all the content. And so that's really what we've been doing, is just gathering as much content, information, questions, you know, anything out there that we can, and just try to consume it all and see how we can best serve our churches. So we have about 3,000 churches in Georgia that we try to serve. You know, they're autonomous. We don't mandate anything. But obviously through all of this, we've gotten a lot of questions. There's a lot of anxiety. It's an uncomfortable situation to be in. And so really that's where all of our content gathering came from. That's the perspective that we wanted to approach it from. We also wanted to be wise, to be smart. And that's also the approach that we're trying to come to all of these guidelines with. So initially, we wanted to try to help get everybody online. I think now we've hit a wall where everybody is almost getting like Zoom fatigue a little bit. I know for me, I have meetings. I'm back in my building, but we have meetings online, half online, or not online. So it's completely shifted the way that we've done business. And I imagine that would be the same for all of our churches. So part of what we have done is consulted with our governor's office. Like Joanne said, at no point were we really mandated to stop meeting. That was never said. But based on the social distancing guidelines that were put in place, it was very, very difficult and highly recommended to stop meeting. Just practically, it wasn't wise. It's not something that we should do. And really, we are still in that position. A couple weeks ago, we were actually planning, what does it look like for our churches to regather? What does that look like? But the issue we ran into was that the governor kind of surprised us a little bit. He came out and he announced, hey, we're going to go ahead and reopen on Friday. And here's what we're going to do. And so we were like, whoa, okay, how do we respond? What do we do? So by that point, we had been able to take our consultants out into Georgia, consult with pastors. We consulted with, a lot of great minds across the country, similar conventions. What are you doing? What are your plans? And so out of that, we have gathered a lot of different resources. So if you were to go to our website, it's gabaptist.org. The very top banner goes straight to COVID-19. All of our resources are there. So the biggest thing that I want you to know is that all of these are constantly changing. We definitely don't have all the answers. What is true today may not be true tomorrow. So right now, we have what we call a living document, a living article that we have on our website. And I'm going to go ahead and post the link for you right now. And initially, this started out for, it was supposed to be 25 things, like the top 25 things to consider. Instead, it turned into 9 areas of consideration with multiple points under it. And so basically, these are things to consider. These are not mandates. These are considerations. So really, we start out by saying, just be informed. Know what the latest is. Stay up to date. Know what your government says. What is true in Georgia from some of our shelter-in-place orders may not be true in Florida. So I know I can't speak specifically to that, but we have tried to keep all of these guidelines and considerations that are very, very high level because, we have congregations that range from 10 people to over 1,000. And so while 10 people might be able to easily meet and still hold church, that 1,000 people, they really can't. And so that's where we try to keep everything really broad. So there are a lot of things to consider. And I think looking at the scale of things to consider, a lot of our pastors have made the decision, it's just not wise to meet right now. Practically, we cannot do it. We talk about how to prepare your church, prepare your building for when you go back. Where are the germs going to be transferred? Do you have enough greeters to stand at the door as people come in to explain how the service is going to take place? Do you do Sunday school right now? What about childcare? There are a lot of things to consider. And for Georgia, we actually have a list of 19 things that we have to do for childcare. And, that involves taking the temperature of the child as they come in the room, one person designated to check the children in. You don't pass anything. Parents aren't allowed back into the childcare area. And so out of all of that, like I said, there are just a lot of considerations. And so it would probably take a while for me to go down through every single section here that we have in our guidelines. But the biggest thing that we want to communicate, and that I've been trying to share with our pastors and what I've gotten back from our pastors, is just be wise. If you're asking the question of, do I need to wear a mask when I'm taking care of a child? Then maybe it's too soon to go back. Are your schools back? Then maybe it's too soon to go back if they're not. You know, we've had to cancel our camps. So June and July, we're probably canceling July. All of our camps, our VBSs, we've looked to training people to do something online instead of gathering in person. Let's see, as far as how to actually do church, our governor, while we are able to meet, is still encouraging drive-in or online services. And, you know, the big thing to remember, there is no rush to get back to the building. At this time, you know, I think we have a lot of hesitation about being the first person back, you know, the first church back. What if something goes wrong? Do you want that to be you? And that's where the anxiety, I know, for a lot of our churches is coming from. And like I said, just practically, it just isn't going to make sense right now to go back, especially when you consider the ability to get hand sanitizer, masks, to apply all the protections that you're going to need to apply to your building. It may just not be practical right now. You know, your volunteers, a lot of our volunteers are over 65 years old, and we have asked them to stay home, you know, just in our state. And that shelter in place order goes through mid-June for them and for the immunocompromised. So if those volunteers can't be there, you know, your manpower, your workforce, your volunteers in your organization is cut down. I know for ours is probably cut in half. So there are, like I said, just a ton of considerations. But the biggest thing is just be wise. As you make decisions, we want to communicate wisdom, and make sure you communicate with your congregations or your members. You know, they want to know what's going on. I know for my church, we're getting a lot of questions about, hey, when can we go back? When can we do this? And yes, those are very valid questions. And I think it's okay to say, I don't know. And that's okay. We want to be safe. We want to be wise. Join us online, and invite your neighbor to join us online. You know, tell them how they can join us. And I think, you know, there are times where we can get into uncomfortable situations. This is uncomfortable for us. We're doing things a lot different. But in those moments, we are asked to grow a whole lot. And I think that's where I have seen a lot of our churches, a lot of our pastors, even me, has had to grow a lot. And part of that is learning how to practice that wisdom, practice that patience, and to encourage that for the people that we're also trying to serve. I think, you know, we can't pinpoint a comeback date. So that's something right now. I want to say that we are probably in a phase 1 of just considerations for opening the church. I don't know of any of our churches that have actually decided to meet unless they are smaller and can meet the social distancing guidelines. Otherwise, they're online, they're drive-in, they're combining with other churches. Their ministry looks a little bit different, but it's still pretty effective. And something that some of our churches are doing just to communicate with their congregations is actually to send out a survey and to say, hey, what do you expect from us to feel safe, to quell your anxiety when you come back to the service? We don't know when the date is, but when you do come back, how would you feel if we did this? And they've gotten a lot of good feedback from their congregants. And so we do have an example survey that I'd be able to provide if that's something that you're interested in. But otherwise, that's where we are. That's where we are in Georgia. So let me know if you have any questions. I love questions. If I don't know the answer, I'll definitely try to find it.
Thank you so much. If specific questions come in for you, I'll make sure that we get back to you at the end of the session. We want to make sure that there's enough time for Gail from our health department. And let me just say too that while our churches and synagogues, mosques were never technically closed, some, depending on what denomination you are with for the churches or synagogues, you may have another body that has told you as a congregation not to open. And so you may have a religious decision maker that is controlling your decision to open, as well as what, from the government perspective. What we're trying to do today is to help give you the tools that should you choose to meet in person, you do that safely, and we can be of assistance in the best way possible and give you the resources. A lot of people have been asking already, Gail, about the supplies, whether it's a child care center in the church, or if it's how to sanitize the pews or how to sanitize the stuff. I know I live up here in Tarpon Springs, and in Tarpon, we have one of the distilleries that's been passing out hand sanitizer, whether to an organization, a congregation, to the public, but people don't know necessarily where to access stuff like that. So I would just ask that in your presentation, because now I've seen that from several people, if you would make sure to go over some tips for that, because we go to the store and we see supplies are limited. How do we combat that if we're a congregation, synagogue, or mosque? So Gail, I'm looking forward to your big presentation.
Oh, Joanne, it's too much. Welcome everybody, and thank you again for taking the time out of your day. Like Joanne said, it's really about tools and what we can provide to you, information. Just like Linda said as well, just because you can meet doesn't mean you have to meet. And I think Joanne brings up a great point. If it's difficult to purchase sanitizer to make your congregation safe, then maybe it's not the time to do that. So what I'm going to do for you today is not only you're a Zombie because you're on Zoom, but I'm going to make you a death by PowerPoint. I'm going to show you a little bit of a slide to talk a little bit about the science of COVID. Now, the beauty of the science of COVID is that we don't know a lot about COVID. We know enough to be dangerous, but we just don't know a lot about it because it is novel. And the reason they call it novel is because it's new and we don't know everything about it. We do know that it is a lot like the SARS outbreak that we saw across the other seas. But a lot of people have equated it to flu, and it's similar to flu, but we don't want to make people think that everything is the same. So we're going to talk about the science. We're going to talk about the new normal, what we're in right now. We're going to talk about the safety considerations. And I want to thank Linda because I used some of her guidance off of her website for our toolkit. And we'll talk about the checklist and do some Q&A. So when we talk about the outbreak, we are still in the midst of an outbreak. And I want to caution everybody, as we have started to open up the county, the unfortunate part, and I want to make sure everybody understands this. In Pinellas County, when we say that there are approximately 1 million people, we have only seen 788 cases. So if you do the math, that's not a lot. So while we're saying we're not seeing a lot of new cases, it's because we've social distanced. So we've proven that it actually works. If you're interested in any of the data or any of the information that we're sharing, there's a wonderful website that Florida has put up, and it talks about every county and the cases and the spread of ages. For Pinellas County, our age range goes from 1 to 101. So it just goes to show that everybody is susceptible. There is nobody that is not going to be able to get it. Now, there is an instance where people have shown no symptoms or very mild symptoms. So that's concerning because people can transmit it without knowing it. What we do know works is that we social distance. That's the thing that we know for sure. So when we talk about cleaning supplies and we talk about how you wipe down high-touch surfaces, ultimately the spread of people staying away from each other works. Now, I'm sure you may have seen some of the videos where people sneeze and it goes for a very long time, and people are debating, is it 6 feet, is it 28 feet? Ultimately, you want to not be in close contact with others. So try to stay away from, as far away from them as much as possible. And again, this is what we know works. The symptoms can appear between 2 and 14 days after exposure. So we look at sometimes 5 to 7 is the average. So we were watching and we were waiting because we knew Easter was upon us and people like to get together for Easter. So we were expecting a spike after 5 to 7 days. Similarly, with Mother's Day coming up, we're expecting the same type of spike because as much as people are trying to stay from each other, they miss their moms and they really want to see their moms. So we're watching these metrics to see if we can figure out if there was still some congregations going on. So how's it prevented? Well, the prevention is, like we talked about, is the simple things that you've heard, like your mom has always said. You want to wash your hands with soap and water for 20 seconds or more. You want to use a hand sanitizer with at least 60% alcohol, and it does work. It is effective. You want to avoid touching your eyes, your nose, your mouth, and again, avoid contact with people, and then staying home when you're sick. Most of the infections that we've seen are transmitted when people go to work or somewhere where they're still ill and they transmit it to others. So let's talk about the mask, because as you may have heard, we initially weren't recommending masks because cloth masks don't protect you. And that is true. They don't protect you, but they protect others. So if you are one of those people that may be shedding virus, it does help protect the people around you, which is why in Pinellas County, they're asking people to go to stores, go wherever you go, and put a mask on to make sure that it's safe. And again, thanks to some of the faith-based communities, I've seen a lot of masks being made because we have some really dutiful people that are putting it together, and it's really appreciated because it matters. Because if you can have a quilting club, you can have a mask club, and it really has helped some of these places that need it. So there is no treatment at this time. You know, there is some talk about some drugs that may or may not work, but there is no vaccine right now. And so we want you, if you're concerned, to call ahead to your provider and be tested. Testing has been limited. We are aware that it's been very limited, and as much as we want testing to be out there everywhere, it's really been a challenge. And the good news is within the next 2 weeks, we're really going to see an increase in testing capability. So if you have concerns, you really should be tested. The health department does testing. We do testing Monday through Friday. I'll make sure that Joanne passes all this information out to you because we want to make sure you do that. We also did some pop-up testing in St. Pete, and we're going to continue to go throughout the county to go closer to people who may need the testing. The community health centers have also started testing. They're testing people with or without symptoms and available to everyone. So they're starting, as well as other testing sites. So we're really excited to see that the testing is going to increase. So if you're tested, and I think sometimes people are confused, if you're tested and you're concerned that you may be you may have COVID, you need to continue to avoid contact with others. We've had people who have been tested and then continue to go about their business. And ultimately, if you have concerns that you have this disease, you need to stay home and stay away from people. We're now starting to promote some literature when we test people to say, stay away from folks and monitor everywhere you go, because we have to know where you've been for 14 days prior to see if we can figure out who you've touched and who you've been in contact with. Because again, we know that social distancing has worked because we've seen the cases dramatically decrease. And now that the order for Florida has started up again, we are expecting more cases to continue. So what are the faith-based considerations? So again, like I said, thank you to Linda and some other groups that have really helped us think about these things. There's also a CDC website that we can promote. We're talking about community and faith-based organizations, because we said, you know, it's not, just because you can doesn't mean you should. So some of these considerations should be taken into account. So the guidance that we want to address is the social distancing, high-touch surfaces, communication with your congregation and anybody else that you have in mind, and anything else that you may think of. So some of the, and this particular checklist that Joanne is going to help provide and Mary will provide to you, it is not all encompassing. It is a way to sort of think about some of the practices that you work with and some of the things that happen in your building. Because again, like Linda said, the worship doesn't have to be in the building, but there are other things and other ancillary services and things that happen in your building that you have to consider. And I know there was a question about childcare, and I'll talk about that in a second. So social distancing. So whether you're a group of 10 or a group of 200, if you want to open your doors up, how would you keep people separate? And this has come up before where, you know, even the sheriff had said in some of his orders, if you're a family, you can sit together, but anybody else in the pew has to be, you know, 6 foot apart. So consider, you know, sometimes you block off your balcony because you don't want people sitting way up high, but maybe open up the balcony so you have more areas to sit. Think about the things like weddings and funerals. I know a lot of funerals have not happened, and it's traumatic. And I think a lot of the mental health issues that are going to go on in our community are going to be long lasting. So those are things to consider. Instruction in children's worship. Office and administrative functions, you know, so we talked about people working from home and using Zoom. So that might be something you still need to consider. Who else might be in your building? Things like Narcotics Anonymous or Alcoholics Anonymous, these folks that, and in fact, prior to the order, they were still allowed to meet as long as they met the social distancing guidelines. So those considerations are if you still allow those folks to be in your building. Food pantries. I know that Mary talked about how the faith-based organizations have really stepped up and helped with some of the food distribution, and we want that to continue because there are a lot of people that are struggling now. So just not mental health issues, but financial and food issues are really, really bad right now. So we really want to think about strategies where we can assist folks in the community, but keep everybody safe at the same time. Shared meal strategies, Wednesday night dinners, very complicated, you know, again, because of seating. You've heard that the restaurants in Pinellas County have to be at 25%. So those are the things that you would want to consider if you want to consider going back to a shared meal, because that's, you know, that's always been a great religious, you know, strategy, is to have people have a communal meal where we can all have fellowship. So it's unfortunate because really, I think of anything, all these guidelines are, we don't want it to destroy the fellowship. We still want to have ways to have fellowship, but we just have to think strategically. We talked about fellowship and handshaking. You know, handshaking may be a thing of the past. We have to think of other ways to do a great wave and a smile to others. Linda talked about the door greeters and some other things that we need to consider. High touch surfaces, depending on your faith, depends on what you may have. I've read a lot of discussions where you would want to remove Bibles and pens and envelopes from the back of the pew because you don't want too many people to touch them. A lot of the Bibles and other religious material may not be a smooth and easily cleanable book surface, so that's something that you don't want to destroy. So anything that you can think of where people touch, you know, door handles and seat backs and water fountains, these are things that should be cleaned more often than you probably are doing now. So again, if you don't have the tools to do that, that's something to consider. There are some people that asked about closing restrooms and closing water fountains. And as you all know, if you have folks in your building for more than an hour, somebody's got to use the restroom. So it's really not a way to strategize your sanitizing and cleaning. Soaps, and let's not forget, again, like we want to talk about with washing your hands is still the best strategy. So as much as you may not be able to get hand sanitizer, if you have the ability to get into a bathroom and wash your hands, I think that's really, we shouldn't forget that that's really important. And then Linda said the communication, you know, you want to give your folks an expectation of what the new norm may be. And she's right, you know, maybe ask the question, what would you like to see to make yourself feel safe? What would encourage you to have different worship where everybody can be addressed with illness or non-illness? You know, all those things that we've talked about really is important to ask the community what they want. And then some of the other things like mission trips, it probably isn't the best time to go on an airplane right now. High-risk individuals, those that are 65 and older, or those with comorbidities, still should stay home. And as much as you can, promote their social distancing. I think it's important, because if you've read any of the information about this disease, the risk to those that are at a higher age limit is much higher. So it's really important that we know that their outcomes are poorer. So we have to be very careful with those. And if there's an opportunity for your congregation to assist those who may be home, who may need food delivery or anything else like that, I think it's important to recognize that. And then again, we talked about the mental health and well-being issues. I do think that it's time to actually try to reach out the congregations and reach out to the community. It may be an opportunity to get new folks into the fold, because they can anonymously kind of peek in at your delivery, at any of your presentations, and kind of see what it's about, and may give them encouragement in this time frame. So it's a lot, but we have this tool that we'd like to share. It's not the be all end all. It's an opportunity for us to share that. But I want you to be safe, and I want you to think, and I want you, I also want you to call the health department if you have questions, if we can help you in any way, because, if you were to have a member become positive and they were in the building while you had service, we're going to have to track down all those folks who were near to that person to make sure that they're safe and they're checking their temperature and whatnot. So we really want to encourage safety as much as possible. And it's not going to be forever, but will it be a new norm? Probably. It's going to take a long time for a lot of people to get this immunity. It's going to take a long time for there to be a vaccine. The antibody testing may or may not be as accurate as we want. So we won't have a good handle on this outbreak for a very long time. Because again, remember, only 788 people in this entire peninsula have had this disease. And again, Joanne, I'll turn it over to you. I'll be happy to answer any questions if I can. I do have a list of sanitizers that you may be able to use. A lot of times we tell you to go to an EPA website, which is really hard to figure out. Ultimately, I'll have Joanne send out this list. And what you have to be careful of or cognizant of is any of these sanitizers, they have what's called a contact time. So if you use the sanitizer, you have to leave it on the surface for whatever it recommends. So if it says 5 minutes, you have to leave it on for 5 minutes to get the right kill ratio. So you don't just spray and wipe oftentimes. So I think those are the things that you have to consider with these different viruses and how they're killed. Is UV light something that works? Yes. Do we know how well? No. So again, erring on the side of caution, cleaning as you go, just not sanitizing, but cleaning, protecting people, having them stay away. These are things that you've heard for weeks now, and it's not going to change, because those are the things that we still are trying to promote.
Thanks, Gail. One question was related to the spray. Is spray better than gel?
It depends on the use. I know that for hand sanitizer, people like the gel because they rub it until it dissipates. I know, like you said, some of the unique opportunities to get hand sanitizer, it was more of a spray. And the spray, you can actually spread it on better if you're cleaning a surface. So it's easier to spray it and allow it to either dry or stay on contact for 5 to 10 minutes, depending on the spray. So it's not super hard to kill. What we've seen for the coronavirus is that it's pretty infectious. So it's the droplets that come from people while they speak or while they cough, and that's when people accidentally get it in their nose or in their eyes. When we talked a little bit about the mass, I think when people aren't used to wearing their masks, they touch their face more. So we're trying to get people to understand that it's the contact to your face, it's your hands. We've had a lot of anecdotal information about people wearing gloves to the store. They touch everything, they're spreading everything. You know, gloves are good if you wash your hands first, put them on, use them for what you're doing, and then take them off. If you go through 3 doors, you're not really benefiting anybody. So.
And what about if somebody chooses to have a meeting in room B and then does not use room B until 7 days later? Do they still need the same level of sanitation? Is there a day limit that people would really be safe? If they don't have all the equipment, can they just shut that door and say, we're good to go next week at this time? Or is even that too risky?
We don't know exactly how long it remains on surfaces. What we have found is sometimes when we're looking for the virus, we may be seeing dead virus. So that's why the data isn't really exact. What I will say is it is better to shut the door and not leave the room. I think 7 days would be a good time frame to allow the virus to settle. And for viruses, we do know that they do have to live in a body. They have to replicate in cells. So it is better for it to be it doesn't live very long on surfaces. Now there's some debate, 3 days, 3 hours, but really viruses like to be in a host. So that's why they say that. But really, if you can't, because you want to clean as best you can, but if you can go in the room, shut the door, wait 7 days, I think that's a good time frame to think about.
Okay, and what about in the letter that went out to all the congregations from the sheriff and county administrator? It talked about, we've heard a lot, must not congregate in groups of more than 10. We've heard a lot of that 10, 10, 10. People are asking, where does the 10 people rule come from? And has that changed? Did that come from CDC or some other entity?
I have to be quite honest with you. I don't know where the magic 10 has come from. I will research that and find out. But yeah, that seems to be the magic number. 10 is no more, 10 kids in your family. It's too many. I don't really know where that came from. Is it a way to distance? Maybe that's the issue. But yeah, it's intriguing. I guess if you had to limit, it's a round number. Yeah.
And what about, people are asking too, does Pinellas County, and Aurelis, this might be for you as well, they were saying, does Pinellas County allow drive-in church? Now, we've heard that there are, I believe, a few congregations in the county that do drive-in church. Does the county have any recommendations or do's or don'ts about that? Drive-in gatherings?
We don't have any recommendation on that right now, but the guidance is the best document to read in terms of all the recommendations regarding phase 1, and that guidance can be found in our website, COVID-19 website on the pinellascounty.org.
pinellascounty.org/COVID-19. Is that right?
Correct.
Okay. All right. And people are also asking, who decides the move from phase 1 to phase 2? I believe, am I correct? And that's at the governor's discretion when we would be moved from phase 1 to phase 2? Or is that correct. A local? Okay. It's the governor.
It's the governor, yes. So that is his prerogative.
Okay. And bottlenecking areas like foyers of synagogues, mosques, general congregation, any suggestions on how to deal with that? We're seeing that in stores too, or pick up for food. There seems to still be a little bit of how do we address that bottleneck area. And we've heard, Mary and I have heard, there are some congregations that have marked areas in their parking lot. kind of waiting areas to get in and ushering people in, almost like you would at a store, to help only bring in a few people at a time. Anyone have any comments about that?
I can share a little bit about what I know some of our churches have done. Basically, we have said, you can limit the number of people you actually allow into the service, so you're only hitting a certain capacity. We've recommended even using like a Facebook event, so that you could say, hey, we're having a Facebook event. You can basically register to come to the service, so we know how many are coming, so you're not going to show up and then not be able to get in. There is one church that is doing multiple services during the week. And so they know that means that they're sanitizing after every service. But they basically will do something on Sunday and then look to do something on Wednesday. And it's the same service, but, they're allowing different people to come in. I think my church is actually looking at doing something where they go by the alphabet. So, if you're this A to E, you get to come on this day. But all of that's untested. I don't really know how that is going to work because it's all new, but that's something that we're doing. And then as far as if I can speak to the drive-in churches a little bit, we did have an article that we did with some recommendations for when you do drive-in church. There were no specific guidelines, but we basically said, you can keep the windows rolled up. If you can use a radio system, there's some pretty cheap ones out there. So we might be able to recommend some of those. But there are no bathrooms. Keep the services short. You don't get out of your car. You don't pass an offering plate. You can have a central location where people can drop stuff. There are some of those considerations. But that's just what a couple of our churches have been doing.
Thank you. We're going to do a few minutes of closing because we have some information. I think, Mary, you're going to share your closing screen. First off, let me say that if we were not able to get your questions responded, and there's several that we haven't gotten to yet, and there will be a response to all of them. But they will take just a few days to get that back from the team, and we will be sending out that to everybody. Following this webinar, you'll get a survey in general about the webinar, and we hope that you will take the time to do that because it will give us, since we hope this to be an every few week occurrence on a variety of topics, and utilizing some of you as faith leaders in our next webinars, please take the time to fill that out because as in any event, we're new at this too, and we can benefit from your feedback. This whole presentation be posted on the Pinellas County website, and you'll be able to review this. There will also be next Tuesday night at 5 p.m. a version of this in Spanish. It won't be the exact same thing, but we will have speakers speaking in Spanish with some of the resources translated in Spanish for everybody. So we hope to do that with each of our webinars coming up. You should also, there's a link, some of you may have already filled out a Pinellas County Emergency Management Survey. That was our way of trying to get information about who your primary contacts are during this time. As you know, if we call the church or synagogue or mosque office, chances are no one's going to be there, and it's not the best way to reach you at this time. So that survey is helping upload the emergency management database. It will also help us going forward with hurricane season. Our next webinar in English will be about communications, and we'll have some experts in communications, as well as we want to hear from some of you all who have done some really great creative, utilizing new tools ways to be in communication with your congregations or your other fellowship in general. So stay tuned for more information of that. If you have somebody that you know of that's been doing some great work, please consider emailing any of us on this team, and we will make sure. We have a planning team that is working with these webinars that Mary chairs, and we're always open to adding more folks from our community on that team. We want to make it relevant to what you're experiencing. Mary will also be following up with the copy of most recent legislative guidelines. So as you know, that's going to continuously change, and we'll do our best to try to keep up with all of you on that. The emergency management is trying to send, we know you're having information and email overload. We're going to try to have a weekly email, kind of in a newsletter form, that can share different things with not only you all, but people that might not have been able to join the webinar. So we build that faith list. So again, stay tuned for that. At this time, again, I just want to say thank you so much for trusting in us to give you some good information tonight. I want to thank all of our speakers, and just know that we will be reviewing all the questions that we didn't get to answer tonight, and we will be sending a follow-up. So again, if you were not addressed individually, we will get back to you. So thank you so much, and hope you all have a safe and good night.